Hi, I'm Dr. Paul Lento from the Department of Orthopedics and Rehabilitation. With me today is Sal, our volunteer male model, so we wanted to thank Sal for joining us today. I've been asked to describe with you the upper limb extremity examination, screening examination, as well as the spine examination. Before starting out, though, with any physical exam maneuver, it's very important that you appropriately wash your hands. So I'm going to head over to the sink here. It's a good idea to use hot or cold water. Basically, you just want to try to create some mechanical disturbance so that you can clean the skin and prevent the spread of infection. So that's an important point. I think it also reinforces to the patients that you use proper hygiene prior to the examination, so I think that's another important point. When I get started for the physical examination, after I've taken an adequate history, I like watching the patient disrobe. So I'm going to actually have Sal in a male disrobe so I can really get a good look at his upper extremity, both function as well as anatomy. So Sal, go ahead and do that. In a woman, sometimes it's easier for a woman maybe to partially, obviously, gown them, so where they might have one hand in their garment and you can tie up the robe back like this. I also find that in younger female athlete patients that sometimes a training bra is helpful to do an adequate examination. But for Sal, being that he's a male, we're going to allow him to completely disrobe for the upper extremity examination. Before I also start, I just wanted to highlight some important planes of motion, which are all planes that we move through, and sometimes it's missed on examination. Particularly when you're describing this to a colleague, you can describe to them a particular plane of motion. The three planes that we highlight are the sagittal, coronal, and transverse planes. The sagittal plane is any motion that occurs in front of the body or behind the body in 90 degrees of motion. So this would be considered shoulder flexion, for example, or a sagittal plane motion. The second plane would be coronal plane, or sometimes referred to as frontal plane motion, and that's anything that's in the plane of the body. One way to remember that would be to look at the sutures of the calvaria. The sutures have similar names, so the sagittal suture would be one that's running directly down the middle of the cranium. The coronal suture, which is running in a 90-degree fashion to the sagittal suture, is another way to remember those planes of motion, so the sagittal and coronal. The third plane of motion is a transverse plane, or also goes by axial plane motion. That really involves any type of rotational motion. So if you talk about transverse plane motion through the spine or hips, it's kind of like your twisting motion, or if it's at the shoulder, internal and external rotation, which we'll highlight in a minute, also is a transverse plane motion. The next thing I do is, with any part of the physical examination in orthopedics and rehabilitation, is to start out with inspection. So we're going to start with Sal's hand here, and we're going to look at his nails first. With nails, you can pick up a few things that describe systemic pathology as well as arthritides. For instance, splinter hemorrhages sometimes can indicate subendocardial bacteritis. You could also have hemorrhaging, which may be from trauma. Also clubbing, which may result from pulmonary disorders. And then conditions such as I treat, which are spine conditions, pitting, such as in psoriasis, can sometimes lead to nail abnormalities. And psoriasis can lead to potential arthritides or different types of arthritis. The next thing would be to inspect the palms. And really, when we're talking about the palm, we're talking about the thenar eminence, which is on the radial aspect of the hand, as well as the hypothenar eminence, which is on the little finger side or ulnar aspect of the hand. So it's the hypothenar and thenar eminences. The next thing would be to look at the skin. And really, you're just looking for abrasions. For some patients, particularly patients who may be on steroids or those types of medication, they may have thin skin. You're looking for ecchymosis that may be associated with trauma. The other thing is to look at individual joints. And in the hand, we're talking about the distal interphalangeal joint, or DIP, the proximal interphalangeal joint, or PIP, and then you have the metacarpal phalangeal joint, because the metacarpal bone is this bone and the phalanx is this, so you have the metacarpal phalangeal joint, or MCP. So those are basically the three articulations of the fingers. You can move back proximally to the wrist, and you will have the carpal metacarpal junction, and these are filled with your carpal bones, and there's both a proximal and distal row. The other thing with looking about overall in terms of inspection would be to look for things such as fasciculations, atrophy, or any other types of deformities which may be important. Scars, which may have indicated previous trauma, as well as past surgical history, is also an important key point to check for. The next thing that sometimes